They're calling it the Big Beautiful Bill. But behind the flashy name is a devastating truth. This bill could strip Medicaid and Medicare from millions of Americans. On the surface, this bill promises to cut waste and reduce the deficit. It sounds like a win-win situation for everyone, right? But let's take a closer look at what's really inside. But buried deep inside are massive rollbacks to Medicaid expansion, which could leave millions without essential healthcare services. And it doesn't stop there. The bill proposes fundamental changes to Medicare funding, including raising the eligibility age. That's not fiscal responsibility. That's abandoning the most vulnerable: seniors, people with disabilities, working families, and children. These changes could lead to higher out-of-pocket costs for those who can least afford it, putting their health and well-being at risk. If this bill passes, it could have devastating effects on many people. A 65-year-old retiree may have to delay care or skip medication, putting their health at serious risk. A working mom could lose coverage for her child, making it difficult to afford necessary treatments and doctor visits. Rural hospitals relying on Medicaid funds at risk of closing, which would leave entire communities without essential healthcare services. These aren't just numbers. These are real people, real lives at stake. The impact would be felt by families, friends, and neighbors across the country. This bill is a turning point. It represents a critical juncture in our nation's history, where the decisions we make today will echo for generations to come. It's not about trimming fat, it's about gutting the heart of America's safety net. The very programs that millions rely on for their health and well-being are at risk. And once these programs are gone, they don't come back. Call your representatives, share this video, use your voice to make a difference. Show up to town halls, engage in community discussions. Your presence matters. Tell them, don't cut care, protect Medicare and Medicaid. These programs are lifelines for so many. Because healthcare shouldn't be a privilege, it's a right. Every person deserves access to quality care, regardless of their circumstances. Expert opinions on the bill. Experts from various fields have weighed in on the potential impacts of the Big Beautiful Bill. Doctors have stated, this bill could lead to a significant increase in uninsured individuals, putting a strain on emergency services and increasing overall healthcare costs. Meanwhile, economists argue, the proposed cuts to Medicaid and Medicare could have long-term economic repercussions, particularly in rural areas where healthcare access is already limited. These insights highlight the broader implications of the bill, extending beyond just healthcare to touch on economic stability and community well-being. When experts from diverse fields converge on a single point of concern, it's a signal that we must pay attention. Their voices add weight to the argument that this bill is not just a political issue, it's a human one. Historical context. This isn't the first time we've seen attempts to cut healthcare funding. In the 1980s, similar measures were proposed, leading to widespread public outcry and eventual policy reversals. Understanding the history of these efforts can help us better navigate the current situation and advocate for more sustainable solutions. By looking back, we can see patterns emerge, patterns that inform us not just about policy, but about the resilience and power of collective action. The past is a guide, teaching us that while the challenges may be daunting, the response of an informed and engaged public can shape the future. Potential solutions. While the Big Beautiful Bill poses significant challenges, there are alternative approaches to achieving fiscal responsibility without compromising healthcare access. Policy experts suggest measures such as targeted fraud prevention, administrative cost reductions, and value-based care initiatives as more effective ways to manage healthcare spending. By focusing on these strategies, we can work towards a more efficient healthcare system that serves everyone better. It's crucial to explore these alternatives and advocate for policies that balance fiscal responsibility with the well-being of our communities. Together, we can find a path forward that doesn't sacrifice care for cost. Personal stories. Meet Sarah, a single mother who relies on Medicaid to provide essential health care for her children. Without Medicaid, I don't know how I would afford their medications and doctor visits, she says. Then there's Tom, a retiree who depends on Medicare for his chronic condition treatments. Cuts to Medicare would mean choosing between my health and my savings, he explains. These stories highlight the real-life impact of the proposed bill. These are not just numbers on a page, they are real people facing real challenges. Imagine having to choose between your health and your financial stability. This is the reality for many families and individuals. Let's ensure their voices are heard. Now more than ever, it's crucial to stay informed and take action. Visit our website for more information on how you can get involved. Contact your representatives, join advocacy groups, and spread the word. Together, we can protect our healthcare system and ensure that everyone has access to the care they need. You can make a difference. Your voice matters. Don't wait. Take action today. Every call, every email, every conversation brings us one step closer to a healthier future for all. Remember, it's not just about policy, it's about people. Let's stand up for Sarah, Tom, and millions of others who depend on these vital services. Act now and be a part of the change. Stop the cuts, protect our care. Share this now, before it's too late.